evening and welcome to Mello TV. I'm your host, Nicole Hayles. Thank you for joining us for this evening's Mello TV poll conducted by Bill Johnson. Joining the discussion is our very credible and renowned pollster, Bill Johnson. Also joining us tonight to analyze the finding is political analyst Paul Bourne. We will hear the views of the Jamaican people on tonight's topic, the government's handling of the COVID-19 pandemic and mandatory vaccination. But first, let's start. Bill, the COVID-19 pandemic has been with us for a little over 2 years. Those 2 years, the Jamaica Labour Party-led government has been in power. What are tonight's numbers showing how the Jamaican people view the government's handling of the COVID-19 pandemic?
Okay, I think we should look back, first of all, 18 months ago when we did our last survey and asked a similar question. At that point, 77% of the Jamaican public said the government was doing either a very good or a good job. 8% said it was doing a poor job, and 13% said it was doing neither a good nor a poor job. So there was almost universal recognition of the fact that the people were pleased with the job the government was doing. Fast forward to 18 months later, and all of a sudden, those who think the government is doing a good or a very good job have dropped down to 44%. Those who think the government's doing a poor job are up to 30%, and 20% say the government's doing neither a good nor a bad job. Now, it's interesting. There was a poll released yesterday in the United States that showed that 44% of the public in the United States approved of the job that the government was doing in the United States in terms of COVID. So ironically, our numbers here in Jamaica are the same in terms of approval, in terms of the work that the government is doing. I think people have basically just had it with COVID, and it's just wearing a lot of people down, and people are just anxious for it to be over. And those numbers are showing, those feelings are showing in the reduced numbers, particularly here in Jamaica. Now, if you look at things by the political parties, 64% of the JLP still think the government's doing a good or a very good job. 16% think the government's doing a poor job. 17% say it's doing neither a good nor a bad or a poor job. Whereas PNP voters, 27% say it's doing a good job, 50% a poor job, 19% neither. Now, ironically, a year and a half ago, 95% of the JLP voters thought the government was doing a good job, and 61% of the PNP voters thought the government was doing a good job. So perceptions of COVID back 18 months ago were much less partisan than they are today. Over the last 18 months, all of a sudden it's become more of a political issue. One other thing I'll mention is that in every demographic and political group, with the exception of Republicans, a plurality or a majority still give the government a good or a very good rating in terms of how they're handling COVID. So that's it in a nutshell.
So based on the comparable numbers in the US and Jamaica, is it fair to say that there is global fatigue as it pertains to COVID-19 and how governments are handling the pandemic?
Without question, yes. And you know, this is such an unpredictable disease, and unfortunately, the leaders of the government, whichever government it may be, have to shoulder the blame for the vagaries of this disease. It's a very difficult position.
Paul, let's bring you in here. The people of Jamaica have spoken. What do you make of these numbers? Are they expected or surprising based on what's happening in the country?
They are absolutely not surprising. In fact, I have been tracking this COVID issue for the past 2 years as an academic. And in terms of, it seems as though Bill was actually in my class participating as a student because the numbers are almost 100% what we have got. So, and what we have been saying for some time now to the government of Jamaica and by extension the Minister of National Security, sorry, the Minister of Health and Wellness, that people are downright frustrated with COVID. But not only that, as a result of COVID, and a part of the frustration one can sort of understand is the fact that we have seen an increase in alcohol consumption, we have seen an increase in murders, we have seen an increase in domestic violence. So people are just downright tired of COVID. It is causing them a lot of pain. And that is
Paul,
fundamentally
let's
what is
turn to
going
the
on.
strategies the government have implemented. Chief among them, the disaster risk management enforcement measures to handle the COVID crisis. Is this strategy enough? What should the government take away from the numbers as the poll speaks for the Jamaican people?
Well, the government is in a precarious position in the sense that when you look at the numbers, and when you look at the numbers prior to 2022 in terms of July 2020, based on what Bill has found, it's clear that people thinks that the government handled COVID better when the disease just started. So what would have happened is that clearly the campaigns that the government have been using, and the rhetoric they have been using in terms of jobs, and all of that is contributing to the demise of the program that they really intended on actually using. And clearly, from what people are actually seeing, and you need to understand the interpretation of individuals in Jamaica, that the disaster risk management thing in relationship to COVID is more of a burden than it's trying to help them to actually deal with the matter of COVID. And that is also creating a part of the problem. People are saying, so if I don't wear a mask, you're not charge me for it. And they're already frustrated. Many persons have actually lost their jobs. Crime is actually going up in the area, and then they have to deal with the matter. Or if they don't wear a mask, they'll be charged.
All right, so let's shift our focus from the disaster risk management enforcement measures, and let's turn to the whole issue of vaccination. A huge part of the fight against the virus was a push to get as many Jamaicans inoculated against the virus and therefore increasing our vaccination rates. Bill, the question to the people that should Jamaicans 18 and older be vaccinated against COVID made mandatory? What are the numbers showing?
Yes, and also we should add that the question said unless there was a compelling medical reason not to be vaccinated. But basically, the public is 2-to-1 against mandatory vaccinations. 60% say no, that the vaccination should not be mandatory. Only 32% say yes, they should be mandatory. Once again, these numbers split by party. 50% of the JLP voters think that the vaccination should be mandatory for anybody 18 and older. 42% are against this. With the PNP, it's 24% in favor, 67% against, and those who didn't vote, it's 28% in favor, it's 64% are opposed to it. Now, contrary to the way people feel how the government in general is handling COVID, strong majorities in every political and demographic group are against mandatory vaccination, with the exception of JLP supporters. So this is not a policy of mandatory vaccination is not a popular one by any means with the people of Jamaica. And it's just something that probably should be given some very serious thought.
Wow, very interesting findings. The Jamaican people are speaking very loudly on this matter. Paul, your comments as it pertains to mandatory vaccination.
Well, based on research, even outside of what Sir Johnson has actually found, we have also actually established that. In fact, we actually found about 70%, so it's also in keeping with what Bill has found, that most Jamaicans are saying no to mandatory vaccination. But not only that, when you actually take the issue of mandatory vaccination outside of Jamaica and the wider Caribbean and the wider world, Latin America, Europe, etc., most persons are not in favor of mandatory vaccination. And this, despite the issue of COVID being what it is, there's a clear reality. And the clear reality is persons actually recognize that a number of persons are dying from other ailments, other diseases, as against COVID. So why is COVID pushed on persons as a mandatory issue? And that is a critical part of the problem, because if you were to average the number of deaths by COVID in Jamaica and average the number of deaths by homicide, the number of homicides are more than the number of COVID cases. So why are we not making some mandatory policy to deal with crime in Jamaica? Why is it a mandatory thing relating to COVID? So persons are interpreting the reality of that they're experiencing and comparing what is going on with COVID. And they're saying, if it is that other issues that are more fundamental, more detrimental to health, are not being addressed with the same level of vigor and vitality, why is it that COVID should be mandatory? And that is a critical part of the problem, not only in Jamaica, but internationally.
Very strong views there, Paul. Still with you. Based on the findings, all what the government has done so far since COVID-19 touched our shores of this country, has it been enough? And how telling are those numbers when you speak of the government's COVID-19 strategies versus the people's needs and desires?
Ah, that's an excellent question. It sounds like it's an exam question. No, but let's disaggregate some fundamental issue here. And one of the fundamental issue is, what are some of the needs of the Jamaican people? Bill actually pointed to some of them yesterday. Crime is a fundamental thing for Jamaican. Joblessness is another matter. The matter relating to health is another matter. The matter relating to education is another matter. The matter relating to the road conditions is also another matter in terms of Jamaicans seeing these as things that they want, things that they desire. Now, when you look at this, what the things that the people want, and you look at what the government responded to in terms of COVID, people are saying, no, 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 no. You are putting your priority in the wrong place. Because if it is that persons have the number one problem in Jamaica being crime, and crime has actually gone out of reach, yes, we put more emphasis on the matter relating to COVID, then it's a critical problem. Yes, people understand fundamentally that we have to address this communicable pandemic called COVID, and rightfully so as well. But people are saying that there are other things. So when the government was actually giving away money for a person to be vaccinated, and there are other persons who are jobless, when the government was actually doing other things, when other problems are there, clearly indicating to persons that they are in need and dire need as well. So persons are saying, what is happening? Why is COVID an issue? So when you look at what the government did initially in terms of COVID, it did a marvelous job in terms of making people aware of all of that. The strategies that emerged after is what people are not agreeing with, not the initial strategies.
Paul, before we go to our Vox Pop, tell us, are these numbers loud enough to provoke the government to warrant additional strategies or change course in how they're handling the pandemic altogether?
Well, the numbers are clear, but are they listening? But if they were to look at the numbers carefully, they'll realize that people are not saying modify the strategy, alter the situation. People are saying change what it is that you have. What they are looking is a revolution in terms of thinking, a revolution in terms of how to deal with this. A simple modification of policy, modification of programs relating to COVID is not going to alter these numbers that we are seeing here. People are saying this COVID matter must be addressed, and must be addressed not as is, but a 360-degree turn in terms of how the matter is dealt with.
But Paul, another question. Don't you think that we're putting pressure on the government and the citizens need to do their part as well?
Very, very good. Understand clearly. And this is the leadership is just simply leadership. The government of the country, leadership for the people of Jamaica. So if it's going to provide leadership conditions and situations people are saying to the government, listen, you're not leading us where we want to go. We are not going in, or we do not want to go in that direction. say they do not want them to go in that direction, it should be clear enough for the JLP and by extension the government to understand what the people are saying. The JLP is providing leadership, and leadership requires to listen to your followers.
Okay, so let's lead our way to the Vox Pop. Our team went on the street today to ask the public. This is what they had to say.
He's still doing a great job so far. You understand? And I don't think the children under 17 must get the vaccine.
Honestly, I would say the government isn't handling COVID very well because of the whole curfew. It doesn't make any sense because people are still keeping parties, which is still a lot of gatherings. So I don't think the government is handling the whole COVID thing very well. Honestly, I do not believe in the mandatory vaccine, so I would not say yes because I have a young son and I would not believe it, and I do not believe in the whole vaccine thing.
Kindly a good job, but my problem is I'm there raising everything and see people all they can find things to feed their own. So the curfew and the COVID is not too bad, but it is going to way sky high. So he need to try to cut it back down. He need to put it back at 8 o'clock because too much virus is out, too much people sick in, and nowadays people not wearing no mask. Party I keep too much and they're not doing anything. So he need to put back the curfew at 8.
Well, I think he's handling it good. The only thing I didn't like was the lockdown, but everything else going smooth and good. So I like it. And the airport them open up, so I see my foreigner them. No, I don't like the 5-year one. It could have started from 12 to 17, or from 12 till when you're old enough, when you turn adult. But I think the 5-year-old should do it. We still consider them as a baby.
Putting into the ages between 5 to 17 mandatory, I don't think they should do that. I think it's optional. That's if the parents want the kids to do it, but I don't think the government should do that.
Wow, Bill, you're spot on. Again in 2022, Mello TV has the correct numbers. The views of the people confirm the figures. Your thoughts?
School children and said, do you think school children age 5 to 17, should it be mandatory that they be vaccinated? And it's almost as if these people you interviewed were looking at these poll results. Only 24% say they should be vaccinated, 67% say they should not be vaccinated. And in every group, even among JLP voters, people are against the mandatory vaccination of school children 5 to 17. The JLP supporters are 39% say yes, 52% say no. PNP supporters or voters are 17% yes, 77%. And those that didn't vote are 21 yes, 69% no. So as unpopular as mandatory vaccinations are for people 18 and over, they're even much less popular for school children, 5 to 17.
Bill, let's break down the party numbers. What are they saying? The numbers what are they showing in this question?
Well, they're showing that there's much less adherence to for the JLP supporters to be in favor of a would-be JLP policy. As I say, only 39% of the JLP supporters are in favor of this. 52% are against it. An outright majority are rejecting this idea of mandatory vaccinations for school children. Now, it's going to be interesting with schools opening, and God forbid, one or two schools have a real pandemic within those schools of COVID. I mean, Lord knows what's going to happen at that point. But the people really, as far as the people having spoken, they're really speaking in terms of being against mandatory vaccinations for the entire country.
Paul, you heard the comments of the people in the Vox Pop in 2022, Mello TV. Again, we have the correct numbers. Is the government in trouble? Based on the numbers, what are they not getting right when it comes to handling the pandemic?
Well, I'm not sure what went into the government's decision-making processes to determine what it is that the rhetoric that they use and the jargons that they use and the language that was actually promulgated in terms of social media and the media. I'm not sure what went into that. But if you look at the numbers based on what is happening in terms of the Vox Pop, 3 persons spoke totally against the issue relating to vaccination of actual children. And it was split in terms of 50-50 as persons thinking, well, the government is doing a bad or a good job. And look, we don't know, these guys are GLP, PMP, etc. So when you look at what the Vox Pop is actually saying, compared to what Sir Johnson has actually found out, it's clear in terms of the findings that people are not agreeing with mandatory vaccination. Now, the issue is raised, and the issue can be raised. What happens if there was supposed to be a pandemic after this when school actually opens? And the matter is simple. The fact that the government went into the vaccination campaign, that actually created somewhat of a handicap for them, because many persons actually argued if mandatory vaccination or the argument relating to vaccination were left up to the medical doctors, the scientists, the public health practitioners, they would have been vaccinated. In fact, I did a study and we asked persons, how many of you would like to be vaccinated? And 70% of them said they would like to be vaccinated. However, 60% of them are not vaccinated because of the argument relating to mandatory vaccination. Now, what we are not taking into consideration is a matter relating to distrust of the government. A number of Jamaicans, and it's not only a matter relating to Jamaica, it's a matter internationally, do not trust government. So when the COVID pandemic actually began, and the government was the bearer of that campaign, that is where the problem actually started. Because people did not trust them initially, and then here you are trying to actually defend people's health. And that is fundamentally the challenge that they are having. And will they actually overcome that? Absolutely not. Because if it is that they're not addressing people's fundamental needs and the challenges over the years, because we need to understand clearly, trust is not built in a day, but trust can be destroyed in a second. So what is happening? The fact that people do not trust the government, and by extension, the government, we're talking about the party in power at the moment, putting forward mandatory vaccination is only going to alienate people more.
Paul, your final thoughts before we go quickly.
Well, I'm hoping that all the policymakers, directors who are in various ministries, including the government, are listening to what the poll findings are saying for Jamaicans, because these are done in January 2022. So if it is that you really want to lead and understand what people are saying, look at the poll numbers and decide what you are going to do, Mr. Prime Minister, from here onwards.
Bill, what can we expect come Monday when we continue the discussion?
Oh, Monday, this is going to be terrific. We're going to find out what percentage of the population says they've been vaccinated, which percentage of the population says they're planning to be vaccinated as soon as possible, and the reasons for not being vaccinated. I think it's going to be an incredibly educational program. Also, there are some differences in vaccination rates by political party, as you might imagine, and those are going to be fascinating to discuss on Monday.
There you have it. Join us on Monday and every weekday until February 25 to get the answers to these and other important questions during the Mello TV Bill Johnson poll. And also listen to Mello FM and Rhythm FM newscasts for the recap. I want to thank this evening's guests, political analyst Paul Bourne and our pollster Bill Johnson. I'm Nicole Hayles on behalf of the entire production team. Thanks for watching.